Thank you so much for staying with Monday Special. We're following the expose yesterday on the quack doctor. We're now going to kind of go into patients' rights and privileges. We'll have a story by Evelyn Wamboy in just a few moments. But first, I'd like to introduce you to my panelists. I'll start with my far left. We have Charles Owino, who's the police spokesman, who'll tell us a little bit more about what to do in that situation becomes criminal. And then we have Dr. Ann Kihara. She's the chair of the Gynecologist and Obstetrics Association. She's going to be giving us an idea of the do's and don'ts when choosing a practitioner, particularly in the field of gynecology. Next to me, I have Dr. Nyaim Eli, who's the chair of the Kenya Medical Association, or KMA. And then we also have a couple, Belinda and Nick Ndungo, who choose to visit their gynecologist together. They'll be telling us a little bit more about why they do that and how they chose their practitioner. But first, let's take you to Evelyn Wamboy's story. More victims of the imposter gynecologist, Mugo have emerged with harrowing tales of their suffering at his clinics. Citizen TV spoke to a couple that claims to have paid over 200,000 shillings to Mugo for a service that also cost them a 6-month pregnancy. But as Evelyn Wamboy poses, just how was the plain quack allowed to operate openly for so long? Here's a look at that story.
So
he holds the flyer that first made him aware of Mugo. The free reproductive health services what drew him to it. It was back in January 2015. His wife was 6 months pregnant, and the flyer couldn't have come at a better time.
Wakati nilikuja nyumbani nikaiweka because nilikuwa nimeona Prestige Healthcare wana offer some services for free each and every Saturday. So nikaona it's best to have the contacts with me in case of anything. Inaweza contact the doctor in charge.
And so when his wife was asked to seek gynecological advice after she was found to have a low blood count, they knew just where to go.
I called him that night. He picked my call. Akaniambia gynecology is his major specialization. Ana specialize na gynecology.
This first-time mother, though, knew something was wrong when the doctor gave her strange results after conducting an ultrasound examination.
Akaniambia kulingana na venye naona mtu amekufia kwa tumbo. Aliniambia amekufia kwa tumbo like 2 days zimepita. Akaniambia daktari wengine wanaweza kuwa quack sana. Kwani wanataka nikufe, nilusi na nikufie, nipoteze mtoto. So akaniuliza kama niko na mtu naweza pigia. So at that time nilikuwa nimeanza kushika na kulia.
In the shock, the doctor managed to convince her that an urgent surgery had to be done to remove the fetus.
So siwezi access any communication. Akachukua dawa tembe 4. Akaniambia nifungue mdomo, we need to start the procedure immediately. So venye niliingia kwa hiyo nyumba sikutoka tena. So akaniweka dawa 4 hapa chini ya ulimi ambazo zilinifanya nilisikia temperature yangu ime-rise at 1.
When the husband eventually knew of his wife's fate, he arrived at Prestige Healthcare in Githurai 44, only to find his wife in dire condition and her pregnancy terminated.
I really wanted to know, kama mtoto ametolewa, where is the fetus? And the kind of medication anapewa ni gani? Because also, hata kama mimi si daktari, lakini nilikuwa ninaona anatoa mtu damu na anamwekea immediately.
They were charged 210,000 shillings for the procedure. What so this husband seek the assistance of the Kenya Medical Practitioners and Dentists Board to apprehend him. The board received the complaint, but only wrote back to indicate that James Ndisho Mugo was not registered with the board.
Nikauliza, now what's the way forward? Because mmesema yesi daktari nifanyeje? Wakaniambia, just go to Kasarani police station.
Mugo is had in this conversation with the husband, trying to negotiate with the man not to press further charges.
Okay. You know when such things come up, they come up and they involve so much which does not benefit you as the complainant or even me. I'm just saying, yeah?
This is what our question with my wife. We just wanted to know what happened.
Watu wanatumia hiyo kitu.
Kukulia. Yeah, I know.
Are you getting what I'm saying? People are making business out of it.
Yes.
This is as far as the case went, the police going quiet on them, as did Mugo Wairimo. This is just one of the many stories we have continued to receive since we aired the expose on Mugo Wairimo Sunday, documenting him raping his patients. Mugo only coming out through social media comments and such text messages threatening those people behind the expose. There are doctors and then there are quacks. The difference between the two being in their qualification and registration. But how do innocent victims get to know the difference between the two at a moment's notice? And whose fault is it that such quacks continue to operate illegally, unperturbed, long after they have been reported to authorities? We seek the answers.
Why people are up in arms is because it appeared like you are condemning the entire profession and saying we are all involved in these things, and yet you had the details that this is actually a fake doctor.
In this particular case, who is to blame that this quack is operating?
And the clinic is open. I mean, my honest view is that that is a shortcoming in terms of the regulatory arm of the health sector. And so perhaps quite a bit of blame should go to the Medical Practitioner and Dentist Board, because the assumption is that this thing is open because it is licensed. Now, having said that, we must then also realize that the board as constituted now is centralized in Nairobi. It has a board membership of 16 people only, secretariat of perhaps less than 15 people. So the capacity is really stretched to the limit.
Maybe the case study that we have of this husband who lodged his complaint in January about this particular quack, and nothing has since been done to date. They only took details and said that this doctor is not, should it end there, that telling this guy is a quack, so it's out of our jurisdiction, or what should happen in maybe such an instance?
The board should actually facilitate inspection of that clinic, and if it is confirmed that there are no licenses, then it should actually be closed.
Mugo Wairimo, in the meantime, remains a free man. Evelyn Wambui, Monday Special.
Again, that's just following the expose that Evelyn Wambui and Lulu Hassan carried out yesterday. She's asked some really pertinent questions, which I'll bring back right now on the board, and just turn to you, Dr. Naim Eli. And we saw the board member there say that it was a shortcoming on their part. What would you want to? No, I know. Gosh, you saying it was a shortcoming on your part. That still leaves a lot of people a little bit unnerved that you would say, you know, this is something that we need to look into. But where do you really think the issue lies? Why would you have someone like that operating in the country? He may be one among many. So where do you think the issue really is lying at this point?
My honest view is that the way the regulatory laws and structures are set up now, it's not as all-inclusive as it should be. And like I said earlier, this board is concentrated in Nairobi. We have a vast county. We have 47 counties in the country. Each county requires health services and all that. And by virtue of the fact that it's concentrated in Nairobi, and that for me is a shortcoming of the law that establishes the board, it means that every time you go out to inspect, people can almost predict that the board will be in Nakuru this week or in Kisumu this week. And when you come back to Nairobi, it's business as usual. So there's an urgent need to build collaborations and to increase capacity of that board, so that between the county governments and the national government and the regulatory authorities, there must be a forum that continuously monitors things at all levels, so that the public is protected.
Do you think at this point, following this expose, that's something that's going to be fast-tracked? Do you feel like this has jolted the regulatory bodies?
Yes, it has jolted a lot of people, not just the regulatory bodies. I mean, I listened to the reactions from the DPP, to the police, to the body LSK. And that jolting is a good thing for me, because then we need to go back and ask ourselves, wait a minute, what is wrong with this? We are living in the city and perhaps in the ivory tower in quotes, but things are going wrong. So can we do our business in a better way and collaborate so that we can actually build our synergies so that we can be able to protect the poor and the innocent public that sometimes don't really know who they are going to. Yes.
Before I come to Dr. Ankihara and just get into, of course, we're looking at other practitioners, not just gynecologists, but for you, we'll be specific about that. Going back to practitioners, how can someone verify that they're going to a legitimate medical practitioner, be it an optician, a dentist?
There's a very, very rigorous process of becoming a practitioner in this country. First of all, you must go to school. Initial 5 years, that makes you a medical officer intern. Then you must do your internship. You must pass your internship. Once you pass it, then you get registered. After registration, you must come back for postgraduate training, which usually after 1 or 2 years of working as a medical officer. And postgraduate training ranges from 3 years to 5 years. So it's quite a long process. And even after you've graduated as a specialist, there's still a requirement that you must work under somebody who's already recognized in that specialty. And that qualifies you then in due time to apply for a specialist recognition. So there's a specialist recognition license for specialists. There's an initial registration license for all the doctors. And then there's an annual license for those who work in who do private practice. Yes.
But how would I know, walking into a practice, that this person is legitimate and this one isn't?
My view is that the failure is perhaps in adequate public education. Because we then must tell people that one of the biggest requirements is that the license must be displayed at all times. So that's a very easy thing to verify when you enter a facility, is the license there.
We'll come back to that just in terms of the details of that. Dr. Kiara, this was an issue to do with, a quack gynecologist, and that's why we also wanted to bring you in. What is the mandate of your body, of your regulatory body?
We're basically dealing with capacity building, addressing also medical tribunal and disputes. Research is what we're also engaged in, and literally providing leadership for anyone who's providing sexual reproductive health and rights, particularly pertaining to the reproductive functions and processes. Yes.
Do you also oversee such cases in terms of, I'm sure you have a database of registered, so how did this kind of slip through the cracks?
Well, I'll say this, immediately I did see this particular clip that was shown. There are two ways of going about it, because you have bona fide membership, those who have registered as bona fide gynecologists. But not all of them are actually registered. Some have been in private practice. But a majority of doctors have also registered with the Kenya Medical Association. But the data bank of every single doctor falls back with the regulatory body, which is the Kenya Medical Practitioners and Dental Board. So immediately I was able to log in and actually see that that actually is not a gynecologist. Yes.
Let's look at talking to many women out there, couples, people who are, victims, such as the lady in the clip. How do you go about identifying a gynecologist and verifying this is someone I can visit? In other words, the do's and don'ts of making an appointment with a gynecologist. If you could run us through that.
I think the first thing is as my colleague has said, look for the identification of this practitioner at the clinic. Now, for all of us going to see a gynecologist, you're coming in for a particular service. So the question is, if you are being interrogated by the practitioner, are the questions in tandem with your problem? I could see where they were asking about the ultrasound, and the next thing she's been put on the table and being told the HB. There are gaps. And I always tell patients, where you feel there is reason to suspect I'm not getting the best quality, a second opinion. You don't have to go through care. Get it from a sound practitioner. Because we do have professional competence as what guides us in our practices. I do agree, a gynecologist does do procedures that may be a little bit intrusive. So if you're finding there's hostility right from the onset, and I have a simple mnemonic which I think the public needs to know. Does the gynecologist explain what they're about to do? Does the gynecologist then examine? does the gynecologist then provide you care and alternatives of care? And does the gynecologist make you comfortable?
Yeah, and if he
For
doesn't
a woman, if it's not fitting that equation, raise a flag.
Okay.
Now you have two ways of reporting. One, you have the COGS, which is the Kenya Obstetrical and Gynecological Society. You have KMA, and then we are overseen by now the regulatory body. So there is a track system of surveillance as far as getting to know where does this person fit in.
Okay, we'll come back to you a little bit and find out. You've talked about feeling uncomfortable. If you feel uncomfortable, seek a second opinion. I'd also like to ask about how do you identify that this person is a quack? I know you've talked about a special license, but how do you tell? Let me bring in our Charles Sowino now, the police spokesman, and maybe off the bat I can ask you, where are you in terms of investigations following up on Mugo Wairimu? Has he been arrested? I know he's claimed on social media he's safe, he's fine, he doesn't have anything to hide, and in fact is ready to present himself to the police. Where are you with regards to this case?
Thank you so much. First of all, the Inspector General has taken it with very deep concern on what has happened, given that he has the responsibility to protect everyone, and he's deeply concerned on what has happened. And this morning he has given express directive to the Director of CID to ensure that this particular case is expedited and proper evidence is collected to ensure that the matter is brought to book. But we have had a lot of issues with this gentleman if we look at the historical background. Sometimes last year in November, I think about 6th of November 2014, one lady reported to Kasarani police station that she had visited the hospital for a pelvic scan, and in the process what happened was that she was given some she was sedated, given some kind of medicine, and she went into a sleep, and the time she woke up she realized that she was quite weak compared to how she came, and she was missing even her inner clothes, and that put her in a very awkward position. And then this happened on 1st of November, according to her report, but she came reporting to us on 6th of November after 6 days.
And what happened when she reported?
When she reported, she claimed to have gone to Neema Hospital and visited Medicine Sans Frontiers, and she was called upon to bring medical documents and record a statement. According to the investigating officer and the OCS, because of this exposure now, we got to be more concerned if there was something else, and they said that the lady had not gone back to record her statement or bring these documents, but we are yet to find out more, and I think the Director of CID is going to move in and probably come up with a better forensic formula.
So right now we don't, just going back to the first question, we don't know, you don't know where he is right now. He's still at large.
I suppose he's still at large, but I can assure Kenyans that if he's within the boundaries of the country, we are going to catch up with him.
Where does the mandate of the Kenya Medical Association end and that of the police begin in a case like this?
Many a times, in a case of rape, pure rape, what happens is that it is not even a case of the Medical Board Association initially. The Medical Board Association only comes in terms of registration. But if it is just a reported case of rape, then immediately we take over and we always ensure that the victims are taken to hospital so that we get...
I need to get to the couple. You want to make a...
But perhaps just to interject, I see the role of Kenya Medical Association and the COGS in terms of being an advocacy group, and we can actually help in reporting.
So it's about working, the synergy is working together.
Yes.
I personally feel there's been a lot of silos, and there is actually room for cohesion, because the purpose is one. They're victims at the end of the road. And I know with gender-based violence, we tend to interact quite substantively. But I think the bottom line is the surveillance system. When you do have a problem, how are we actually going to then work together to actually get the sound medicine and the sound policing that should go, and the judiciary?
And you feel like that's still not happening seamlessly as it should?
I may interject shortly. We have a number of times that we work together with the medical board and professionals. Many a times, like for example in the case of this particular alleged doctor, in June this year, the medical board carried out some kind of a swoop and visited his medical center, and he was brought into Kasarani police station and he was charged.
Okay.
One, for employing a lab technician without the technician's certificate, and also for practicing without being registered. And he was taken to court. The hearing is coming up this November. So a number of times when they want to carry out those kind of checks, and then they usually come to...
He was taken to court, but then he still operates. I think that's what people are... We've seen that the practice was shut down a few times, and it's still, he kind of kept emerging and still carrying out his practice. That, for me, is the most frightening thing. Just before you answer that, I think I'd like to bring in the couple very quickly. Belinda and Nick, we have to take a break. How nervous does this make you as patients? You're representing, you know, a group of Kenyans who seek these services. How nervous does this make you?
Very.
Yeah.
Yeah, that your privacy can be violated to that level. It is very scary.
Yeah.
Yes.
I know this particularly, Nick, when we're talking to a lot of our colleagues in the newsroom, this really especially jolted the men. They kind of said, you know, from now on they will accompany, and we'll come to that a little later. But why do you choose to accompany Belinda to visit the gynecologist? You told me that you do it all the time.
Yes.
Why did you make that decision?
We didn't do it for fear purposes, because I think we've always been treated by qualified personnel.
Yeah.
But what really informed our decision was, as Dr. Ria said, you have to go almost 8 years for a practice of maybe 30 years. So for our marriage, we also went for classes to prepare for marriage. So during those classes was when we were also exposed to, especially for gynecological matters, always accompany your wife.
Okay.
So that you can also make an informed decision, both of you, because this is something that affects both of you.
Are you together during the examinations? Like when you escort her in, are you there throughout, or do you just kind of take her in and leave?
I am there, I participate, I ask questions.
Okay.
And if it's maybe minor surgery or something, I am still there.
Yeah, well, that's good. And I think we'll come to that. We really have to go into a short break. Talk to us using the hashtag MondaySpecialKE on Twitter. Text us on 22422. Leave your name and location. We'll continue the discussion after this break.